If we talk now about pregnancy and fertility, two quite different things actually. First of all, the clearest and greatest risk factor for severe outcomes from COVID-19 is age. The risk of COVID is much, much more harmful than the risk of any vaccination that you might need to have. So the current advice that we have is that women who are planning a pregnancy or who are postpartum, so have just had one, or who are breastfeeding can be vaccinated, and as I said, prioritised by their age and their clinical risk group. Our preferential vaccines are the Pfizer-BioNTech or the Moderna vaccine. Having said that, if you have a conversation with your health team or with your general practice team and they, with you, come to a conclusion that you need a particular vaccine, that's the guidance that you need to follow. And although pregnancy increases the risk of clotting conditions, there is no evidence that pregnant women are more likely to get a clotting condition after they've had a vaccination. And there are no safety issues that have been that have actually been identified. But we keep looking at the data, and that's why the JCVI have said it's still preferable for pregnant women in the UK to be offered the Pfizer-BioNTech or the Moderna vaccines where available. But remember, the risk of COVID in pregnancy is much, much higher. So what we're doing is protecting you with the vaccination from the risk of COVID. And we've seen some really distressing stories, particularly through the first part of the pandemic, of women who were pregnant who got very ill or died from the virus itself. And so that's absolutely what we want to avoid. And we will keep watching that data. But what's really important is that we get you protected as soon and as safely as possible.